My name is Brucella. Uh, Today we're going to discuss the bacteria which is known as Brucella. Um, First we want to ask a question about Brucella. Why is it important? Brucella causes reproductive loss in animals, and that affects the economy because there are less animals for us in our community. And so that's how Brucella can affect the community. Brucella can be spreaded also from person to person. Now we're going to look at the etiology of Brucella. It is a member of the genus Brucella. All species of Brucella come from one species, which is known as Brucella melitensin. It's also a gram-negative pathogen in a group of Afroproteobacteria, and it has a coccobacillus shape. Um, we answered the question of why Brucella is important. Now we're going to answer the question, where is this disease located? Where can it be found? Um, Brucella can be found in Mediterranean countries or areas, the Middle East, Asia, Africa, South, and Central America, and of course it's here in the United States. So pretty much Brucella can be found worldwide. It's well known to be around livestock areas in the livestock industry. Places that it likes to dwell are high mugginess, low temperature, and little to no daylight. So how can we obtain this disease? How can it be transmitted? It can be transmitted from animal to animal. It can be transmitted through blood transfusion. It can be transmitted through bone marrow, and it can also be transmitted through sex or sexual intercourse. Unpasteurized milk, also from animal to human, handling of livestock, and ingestion of undercooked meat and undercooked meat products. How does it affect humans and the human population? The infection in the humans is uncommon here in the U.S. There's under zero point 0.5 cases every 100,000 people, and only 100 cases per year in the last 10 years in the United States. Livestock workers are the ones who are pretty much at risk, and it can be transmitted as a blood-borne pathogen. Now I'm going to look at the incubation period of this bacteria. The incubation period for this bacteria in humans lasts about 5 days to 3 months. Most infections seem to become apparently weaker within 2 weeks, and the symptoms are chills, spine weaknesses, and fever. Diagnostic tests. Now we're going to talk about some of the things that are being done in the lab, the dealings with Brucella. Examinations of stain smears, cultures, and serology are things that are done in the lab for diagnostic testing. Okay, now it's time to talk about how to put up a big fight against the big bad Brucella. Um, it's killed mostly by common available disinfectants, which include hypochlorite solutions, 70% ethanol, isopropanol, um, phenolic disinfectant, and formaldehyde are ways that they use to fight brucella. And the doctor treats brucellosis with antibiotics. Brucellosis is a disease which is caused by brucella, and they treat the antibiotics that they use are tetracycline and doxycycline is the effective in therapy of acute brucellosis. Now we're going to look at the morbidity and mortality. Um, Occasionally, it's lethal if treated. Now, it's a difference if it's untreated. If it's untreated, the death rate shifts from 2% to 5% deaths in people that get brucella. And deaths are usually caused by endocarditis or meningitis. This is work site places where I obtain some of my information. We look here. We used the clinical infectious disease. We also used we had a book on the standard brucella diagnostics, and we also had a journal on the treatment of chronic brucella. So those are some of the things, worksite, where I got some of my information on brucella, and just to help put together this presentation. Thank you.